We hit another grim milestone as more people catch COVID. The entire state of Idaho is now under crisis standards of care. That means if you need care in any part of Idaho, it might not be what you expect. Melanie Dow explains how the Gem State got to this crisis care point and what that means for you.
With fewer staff on hand and a large increase of people needing help with COVID-19, it's pushed Idaho hospitals to the limit. This means now some hospitals can choose who to care for first. You might have to wait longer in the emergency rooms, and you could be treated in hallways and classrooms instead of regular hospital rooms. COVID is becoming all too much for the hospitals, for the people who are trying to help.
We've been working really hard and we're maintaining good attitudes and we're doing a great job, but we're human. And we're getting tired.
They're now hitting a point they tried to avoid: crisis standards of care.
This is not anything that any of us wanted.
For the first time in the state's history, the Department of Health and Welfare put the entire state under crisis standards of care. North Idaho reached that level more than a week ago. While Kootenai Health is operating under crisis care, Bonner General Health and Hospital isn't yet, but it's close. Of the 25 critical access bed it has total, 16 people are there. 10 of them are being treated with COVID. Their 4-bed ICU is full, with 2 positive with COVID.
I'll probably never, ever forget standing at our ICU helping a patient who was terminal, urgently dying within an hour. And we had family at the bedside who were talking about COVID being a joke, how it didn't even exist and was blown out of proportion. And I mean, that takes a toll.
Hospital leaders, doctors, and nurses across the state are begging people to do the right thing so that they don't have to pick and choose who gets what care.
This country has gone through harder things. Our grandparents and great-grandparents made greater sacrifices across, over the course of 2 world wars for a lot longer period of time than what we're asking people to do. What we're asking people to do is wear a mask the right way, socially distance when possible, and get vaccinated.
I'm Melanie Dow with 4 News Now.